Welcome to Insulin Pharmacology Mastery. This video will cover high-yield concepts essential for NORCET, AIIMS, and competitive nursing exams. First question. Insulin promotes the cellular uptake of glucose primarily by what action? The correct answer is B, stimulating GLUT4 transporter translocation. Insulin binds to receptors, causing GLUT4 vesicles to move to the cell membrane, allowing glucose into muscle and adipose tissues. Which insulin type has the fastest onset of action? The answer is C, Lispro, a rapid-acting insulin. These insulins are modified to prevent hexamer formation, allowing them to act within 10 to 15 minutes, faster than regular insulin. When mixing regular and NPH insulin, what is the correct procedure? The correct answer is B, regular first, then NPH. Remember the rule, clear before cloudy. Regular insulin, which is clear, must be drawn first to prevent contamination from the cloudy NPH protamine/zinc base. What is the best strategy to prevent lipodystrophy? The answer is B, rotate injection sites. Lipodystrophy occurs from repeated injections in the same area. Site rotation is crucial for uniform absorption and maintaining healthy tissue. What is the priority intervention for a patient with symptomatic hypoglycemia? The answer is B. Give 15 grams of rapid-acting carbohydrate. The 15/15ths rule is the first-line treatment for conscious patients. 15 grams of simple carbs, wait 15 minutes, and recheck. Repeat if blood glucose is below 70 milligrams per deciliter. Which insulin type does not have a peak? The answer is C, glargine. Long-acting insulins like glargine and DMER are peakless, providing steady basal glucose control that mimics the body's natural basal insulin release. What is the primary danger of the Somogyi effect? The answer is B, rebound hyperglycemia after night hypoglycemia. This occurs as the body releases counter-regulatory hormones to compensate for severe nocturnal hypoglycemia, leading to high morning blood sugar. Which body area provides the fastest absorption for insulin? Answer, C, abdomen. The abdomen offers the fastest absorption due to its high vascularity. Absorption speed ranks: abdomen, then arm, thigh, and finally buttocks. How should unopened insulin be stored? Answer, B, in the refrigerator. Unopened insulin must be refrigerated at 2 to 8 degrees Celsius to maintain efficacy. Once in use, it can typically stay at room temperature for about 28 to 30 days. The dawn phenomenon occurs due to answer, B, morning surge of hormones. The early morning release of cortisol and growth hormone increases liver glucose production, causing hyperglycemia upon waking in diabetic patients. What is the peak time for regular insulin? Answer, B, 2 to 4 hours. Regular insulin is short-acting, and its peak action occurs between 2 and 4 hours. This period carries the highest risk for hypoglycemic episodes. Which insulin is the only one that can be given IV? Answer, C, regular. Only regular insulin is formulated for safe intravenous administration, making it the preferred choice for diabetic ketoacidosis management. Other insulins are intended for subcutaneous use. What electrolyte should be monitored when starting IV insulin? Answer, B, potassium. Insulin promotes the shift of potassium into cells. For patients with diabetic ketoacidosis, IV insulin can cause dangerous hypokalemia, even if initial levels were normal. A patient is receiving basal bolus insulin. What does the basal component cover? Answer, B, constant baseline glucose. Basal insulin, which is long-acting, provides a steady background glucose control that mimics the body's natural output. Bolus insulin covers mealtime spikes. When is insulin resistance most likely to occur? The answer is B, type 2 diabetes and obesity. In these conditions, metabolic syndrome downregulates insulin receptors, requiring higher insulin levels to move glucose into cells. Which insulin should never be mixed with others? The answer is D, glargine. Long-acting insulins like glargine have a specific pH that causes them to precipitate if mixed with other types, rendering the therapy ineffective. What is the benefit of an insulin pen over a syringe? Answer, A, better accuracy and convenience. Pens are easier for patients, especially those with mobility or visual issues, and they provide improved dosage accuracy compared to manually drawing from a vial. Which insulin is classified as intermediate acting? The answer is B, NPH. NPH, or neutral protamine hagedorn, is an intermediate acting insulin because the addition of protamine delays its absorption. How does acute exercise affect blood glucose in a diabetic patient? The answer is A. Acute exercise increases glucose uptake. Muscle contraction enhances glucose transport into cells, mimicking insulin's action, and raising the risk of hypoglycemia during or after activity. In which trimester of pregnancy do insulin requirements typically increase most? The answer is C, third trimester. Placental hormones induce insulin resistance, peaking in the third trimester, and significantly raising the need for insulin. What should a nurse assess before administering insulin? The answer is B, current blood glucose and meal timing. Insulin dosage must match the glucose level and food intake to prevent hypoglycemia. Never administer if the patient is not eating or blood glucose is too low. Insulin infusion pumps use which type of insulin? The answer is C, rapid acting, such as Lispro. Pumps require a fast-acting insulin to manage both continuous basal rates and rapid boluses, making rapid-acting insulins ideal for this technology.